So we'll start in another 1 minute.
Yes.
It's sharp 5. With all your due permission, we are beginning with the session for today.
Yes.
Good evening, everyone. This is Batul from IGCP, and I would like to welcome all the viewers who have joined our platform for the better exchange of knowledge that is going to be shared by none other than a very renowned pediatrics whom everybody knows. He needs no introduction at our platform, but it's great honor and pleasure for me to introduce him at our platform. And he is none other than the very renowned Professor Dr. Bharat J. Parmar, sir. Sir is MBBS, MD, DHA, FAIMS, Professor and Head of Pediatric Department at Zydus Medical College Hospital, Dahod, Gujarat, and the National Trainer for Recent Protocol Management of Dengue as well. So with Sir's wonderful insights and with Sir's help, we will be talking about breast milk, smart nutrient for newborn brain. And since we are celebrating the World Breastfeeding Week celebration, so what could be a better topic than this to talk about? So before moving on to today's session, let us have a brief look on what the topic says. Breast milk is a remarkable source of smart nutrients for newborn brain development. Rich in essential fatty acids such as DHA, promotes optimal cognitive growth and neurological function. Additionally, breast milk contains antibodies that strengthen the baby's immune system, protecting them from infections and diseases. During World Breastfeeding Week, we'll be learning more about the topic and we'll be having a series of topics on this to continue with the World Breastfeeding Week. So to start with the first series and to start with Professor Dr. Bharaji Parmar, sir, I would like to welcome sir at our forum and would like to hand over the session to him for his precious talk to begin. So over to you, sir.
Okay. Thanks for your kind words. First of all, good evening to all. I'm very thankful to IGCP group for giving opportunity for sharing my knowledge about important nutrition of the newborn baby, that is a breast milk. This first week of August is a World Breastfeeding Week. So today I will highlight about the breast milk. It is a smart nutrient for a newborn baby. Not moving.
No, sir, it's not moving. You can stop share and share it again from there itself, sir.
Top say.
Again, share it from there only, you will get the option.
Go all natural breastfeed. Breastfeeding is a foundation of life. Breastfeeding for a healthier planet. Breastfeeding empowering the babies. Breastfeeding empowering tomorrow. And breastfeeding educate and supports. Optimal breastfeeding is one of the most effective ways to ensure child health and survival. The World Health Organization recommends initiation of the breastfeeding within first hour of birth and exclusive breastfeeding for a first feeding for the first 6 months of life. Early initiation of breastfeeding is an important intervention that ensures that the baby receives colostrum and also increase likelihood of successful exclusive breastfeeding. The word nutrition is derived from nutricus, which means to suckle at breast. Breast milk is a natural food for the infant and it is species specific. Successful breastfeeding is an important child rearing skill to be learned and practiced. After introduction of the Baby Friendly Hospital Initiative, BFHI, in 1992, exclusive demand feeding is accepted as the only mode of early infant feeding. Babies are well known to thrive on breast milk alone during 4 to 6 months of age. The World Alliance for the Breastfeeding Action, WABA, is a global agency for promotion of breastfeeding. Every year, the World Breastfeeding Week is celebrated from first week of August. There is a 1st August to 7th August. And the year 2001 marks the decade of celebration of World Breastfeeding Week. The breastfeeding is now accepted as a human right, a right of baby as well as the mother. The BHFI is a global program organized by UNICEF, and it was launched in 1992 and adopted by India in 1993. The operational guideline for breastfeeding, antenatal checkups, delivery room, primary immunization session, measles immunization, booster immunizations, pulse polio, and any illness. These are the components of operational guideline for breastfeeding. First component, that's the antenatal checkups. To motivate to exclusive breastfeeding during antenatal visits, ensure the rest and extra meals include leafy vegetables and fruits, and undertake physical examination of breast and the nipple and correct the defect if any. Delivery room. Initiate the breastfeeding soon after the delivery. Discourage the prelactal feed. Practice rooming in and bedding in, and practice exclusive breastfeeding 8 to 10 times in 24 hours, and also night feeding to prevent hypoglycemia. Primary immunization session, confirm the exclusive breastfeeding, sort out the practical problems, and during the third dose, advise regarding weaning and hygienic preparation of the food. Confirm the continuation of breastfeeding and weaning food and give stress on a family for feeding to the baby. Ensure the breastfeeding and adequate food intake, stress on hygiene, and advise one extra meal for 2 weeks after an illness of the baby. Preparing the mother for breastfeeding. The antenatal mother has to be motivated and prepared for breastfeeding. In the last trimester of pregnancy, breast and nipple should be examined for retracted and cracked nipple. An antenatal mother should take extra 300 kilocalorie and 15 grams of protein, and lactating mother take extra 400 to 500 kilocalorie and 25 grams of protein. She should take plenty of green vegetables, seasonal fruits, and the fluids. Art and technique of breastfeeding. The key signs of good attachment for breastfeeding. More areola visible above the baby's mouth than below it. Baby's mouth is wide open. Baby's lower lip is turned outwards, and baby's cheek is touching the breast. Key signs for proper position of breastfeeding. The baby's head and the body should be straight. Baby's face should face the mother's breast. Baby's body should close to the mother body, and mother should support whole baby. Correct positioning will ensure effective suckling and prevent sore nipple and the breast engorgement. Effective suckling and swallowing. An infant take several slow, deep suck, then pause. What is enough breast milk? How will you assess? Breastfeeding is considered adequate if the baby passes urine 6 to 8 times in 24 hours, goes to the sleep for 2 to 3 hours after feeding, weight gain 10 to 15 grams per kg per day, and crosses birth weight by 2 weeks. Initiation of breastfeeding. Baby must be put to the breast within half an hour after the normal delivery and within 4 hours after cesarean section. Prelactal feed like cold rub in a water, honey, distilled water, glucose should not be given, and this term will satisfy the thirst and will reduce the vigor to suck and may lead to diarrhea and helminthitic infestation. So avoid prelactal feed. Soon after the birth, baby is awake, alert, and biologically ready to breastfeed, and initiation of the breastfeeding is very easy. In first 2 to 4 days, small quantity of colostrum, there is a 10 to 40 ml, that is secreted in what the baby needs. Colostrum is rich in protein and immunoglobulin. Rooming in is keeping the mother and the baby in the same room. Bedding in, keeping the mother and baby in the same bed. And mother in is keeping the baby on the abdomen of the mother. There is a KMC, kangaroo mother care. These measures ensure mother-infant bonding and skin-to-skin contact. Skin-to-skin contact, eye-to-eye contact, and mother-infant bonding, it leads to successful breastfeeding and emotional adjustment. Sucking should be continued as long as the baby desires to suck, and this will satisfy the sucking instinct of the baby and will express the hind milk, which are more nutritious. When sucking takes place only few minutes, the baby will get only the fore milk. This will satisfy only the thirst of the baby, and hind milk has to be fed to satisfy the nutritious demand and to ensure more milk production. Reflexes that help in breastfeeding. Three reflexes, namely rooting reflex, sucking reflex, and the swallowing reflex, help the baby in a breastfeeding. When the breast nipple is allowed to touch the cheek of the baby, baby will open the mouth and initiate sucking. This is called routine reflex. Sucking and the swallowing, they become coordinated by 34 weeks of gestation. Sucking by the baby, that's the prolactin milk production reflex, and the oxytocin, there's a milk ejection reflex. They initiate and maintain lactation in the mother. Sucking acts as a afferent stimulus for the prolactin and oxytocin reflex, and oxytocin reflex is also called let-down reflex. Let-down reflex will be efficient only when the mother is relaxed and comfortable. Colostrum is replaced by transitional milk in few days and later on by the mature milk. It gradually increases till 6 months after delivery and later plateau off. An average quantity of the breast milk 500 ml to 800 ml per day. Common problem during breastfeeding. Flat and inverted nipple. Inverted nipple cause serious feeding difficulties leading to engorgement of breast. The mother should be instructed to pull out the flat and inverted nipple with the thumb and index finger, and the nipple should be rolled between thumb and index finger and pulled out before feeding. Series method is effective for treatment of flat nipple if above procedure fails. Fullness and engorgement of the breast. Local application of the warm packs and intake of safe analgesic paracetamol relieve the pain and congestion due to breast engorgement. Sore and a cracked nipple. Correct positioning and the attachment of the baby to the breast. Hind milk should be applied to the nipple after feed, and the nipple should allow to heal between the fed. Breast abscess. Mother must be treated with the analgesics and antibiotic, and abscess must be incised and drained. The breastfeeding must be continued from other breast. Burping after feeding. Babies tend to take in a lot of air during feeding. This will lead to abnormal distension intestinal colic, and regurgitation. To get rid of these, the mother has to do burpee. The baby can poo on a left shoulder and the head has to supported with the mother's left hand, and then with the right arm support the buttock and gently pat on the baby's back with the right hand, and slowly air will escape and baby will become comfortable. Burping can also be done in other position. Place the baby prone position in a mother's lap and gently pat on the back. Position of the baby after feeding. Baby can put in a right lateral position after feeding. This will prevent aspiration. The prone position is not currently recommended, as it is found to be associated with higher incidence of sudden infant death syndrome SID in some studies. How to know whether the breast milk is sufficient or not? Is baby frequently passing plenty of pale colored urine, that is 6 to 8 times in 24 hours, and goes to sleep 2 to 3 hours after the feeding? If the baby is passing 1 to 6 liquid stools per day, and if the baby weight gain adequately. Weight gain is exclusive breastfed baby. The slogan, breast milk for a brain growth and cow milk for a body growth, is worth stressing. How often to breastfeed? Ideal frequency of breastfeeding at least 8 to 10 times in 24 hours, and also night feeding to avoid hypoglycemia. There is no tailor-made schedule, as a milk production, sucking habits, stomach capacity varies from baby to baby. How long to breastfeed? Breastfeeding should be continued well into second year of life. It is better to breastfeed till 2 years of life and the period of maximum brain growth and myelination of the brain of the baby. After 4 to 6 months of age, weaning food should be offered in addition to the breastfeeding. Whether to breastfeed when the baby or mother is ill. Breastfeeding should be continued when the baby has a minor illness. And expressed breast milk should be given if the baby cannot suck. Contraindication to the breastfeeding. There is a congenital lactose intolerance and the galactosemia, or mother intake of anti-cancer drugs, anti-thyroid drugs, and antipsychotic drugs, lithium. These are the contraindication of breastfeeding. Virtue of breast milk. Breastfeeding provides unique health benefits both to the baby as well to the mother. Benefits to the baby. The physical benefits are optimal fluidity and warmth. It is very economical. It is very convenient. It can be made available anywhere at any time. It is very physiological. It is sweetest milk with a high lactose content, and the protein is easily digestible, and these lipids are rich in essential fatty acids, long-chain polysaturated fat, phospholipids precursors. It supplies enzymes like amylase, lipoprotein lipase, bile salts, lipase oxidase, lactoperoxidase, leukocyte myeloperoxidase. These enzymes, they increase digestibility and also act as a defense against microbes. It also contains growth regulating factor, growth promoting factors, and the growth modulators. The long chain fatty acid promote brain growth and reduce dyslexia and hyperactivity in the baby. Thus, Breast milk is a complete food and provide all nutrients the baby needs during first 6 months of life, except vitamin K and vitamin D. Biochemically, the breast milk is superior and the protein is mostly whey protein, 80%, rich in alpha-lactalbumin and lactoferrin, and the rest is casein, there is a 20%. Lactalbumin is rich in tryptophan, which is a precursor of serotonin, which play important role as a neurotransmitter. Lactoferrin ensure absorption of iron and zinc, and it is bacteriostatic as well. It binds iron and makes unavailable to the bacteria. Alpha casein and the lactoglobulin, which are allergen, are absent in human milk. It is also rich in binding protein that binds thyroxine, B12, and vitamin D. The calcium phosphorus ratio is more than 2. It ensures calcium absorption. And the lactose promotes calcium and magnesium absorption. The solute load is low due to the low level of the protein and certain minerals in breast milk. It ensures gentle load on an immature infant kidney. At the same time, there is a provision of optimal vitamins and the mineral essential for healthy growth of the baby. Microbiologically, the breast milk is sterile with least chance of contamination. Lactoferrin is a bacteriostatic and it inhibits E. coli. It binds iron and makes it unavailable to the E. coli. Peroxidase and the lipase, they kills bacteria. Bile salt stimulated lipase, they kills amoeba and giardia. And para-amino-benzoic acid PABA is important in a protection against malaria. And the transfer of maternal antibodies and the T lymphocyte may also offer some protection against malaria. Immunologically, breast milk is extremely safe and it is a non-allergic and it supplies passive immunity. Macrophage, lysozymes, and the complements offer immunity to the baby. It also supplies acute phase reactant. Nutritional composition of the breast milk, it supports the gut microflora, which play essential role in enhancing the immunity of infant. It contains immunoglobulin, secretory components, and secretory IgA. Secretory IgA offers surface protection to the respiratory and the gastrointestinal tract. Immunoglobulin other than secretory IgA are generally split in the gut. Secretory IgA are produced in a mammary gland by the plasma cell and that originate from immunocompetent lymphoid tissue, namely gut-associated lymphoid tissue, GALT, and bronchus-associated lymphoid tissue. There is a bulk by the virtue of enteromammary and the bronchomammary axis. Breast milk supply T and B lymphocytes. T lymphocytes are responsible for transfer of immunological memory. The bioactive factor in the milk are protein like lactoferrin, non-protein nitrogen-like nucleotides, enzymes, hormones, growth factors, factors for the host defense, oligosaccharides, mucin, probiotic substance, and the polyamines. The bifidus factor, it promotes the growth of lactobacilli. And polyamines like spamine, spermidine, and the putrescine. It promotes the cell growth and the differentiation. Putrescine is a precursor of gamma aminobutyric acid. GABA is an inhibitory neurotransmitter. Psychologically, it ensures emotional stability and personality development due to close contact of the baby and mother, and there is a mother-infant bonding. Breastfeeding stimulates all five spatial senses of the baby. There is a touch, sight, smell, hearing, and the taste. Breastfed babies are smarter and have shown to have 8-point higher intelligence quotient and higher concentration of two key long-chain fatty acids. That is arachidonic acid and docosahexaenoic acid, there's a DHA. Iodine, zinc, taurine, choline, and the lactose, they promote the brain growth of baby. Breastfed babies are less likely to suffer from dental caries, type 1 diabetes mellitus, obesity, high blood pressure, heart attack, celiac disease, inflammatory bowel disease, and certain cancer during adult life. There are no risk of adulteration, dilution, contamination, and infection in a breast milk. The risk of cot death or sudden infant death syndrome is less in breastfed babies. Epidemiologically, it decreases morbidity and mortality. It is estimated that breastfed baby is 14 times less likely to die from diarrhea, 4 times less likely to die from respiratory disease, and 2.5 times less likely to die from other infection than non-breastfed baby. Benefits to the mother. During the breastfeeding, there is a release of oxytocin to eject milk, and oxytocin helps contract the uterus so that there is a reduced risk of bleeding and anemia after delivery. Breastfeeding delay ovulation and onset of menstruation, which provide natural means to ensure spacing of children. And nevertheless, the protection is not foolproof, and the mother who are breastfeeding must seek proper contraceptive advice. Mother who breastfed their baby have a reduced risk of developing breast cancer, ovarian cancer, and osteoporosis. Composition of human and cow milk. Human milk, there is a total, it is protein, there is a 1.1%, and in cow milk 3.5%. Casein, it is 30 to 40%, there's a 0.4%, and in cow milk it is 2.8%, 80% casein, caseinogen there is, so there is a constipation due to the cow milk. And the lactalbumin, there is a whey protein high and beta lactoglobulin in human milk, which is responsible for this allergy and no cysteine and taurine in the cow milk. So cow milk allergy due to this beta lactoglobulin. In human milk, the lactose is 7.4% and high lactose content useful for retention of calcium and iron, and it promotes the synthesis of cerebrocytes in the brain, important for brain growth. In cow milk, the lactose is 4.5%. And human milk, fat is 3.4% and cow milk 4.5%. In human milk, the quantity is enough and it contains unsaturated fatty acids, high content of galactolipids. It promotes the rapid brain growth. That is the first 2 years of life. And the cow milk, there is a 4%, there is mostly saturated and less quantity of essential fatty acids and the low cholesterol. So in human milk, unsaturated fatty acids, important rapid brain growth. In human milk, enough quantity of essential fatty acid, there is a DHA and nucleic acid, there is a 10 milligram per DL, important for brain growth. While in cow milk, there is a less quantity of essential fatty acids and the low cholesterol. While in case of human milk, there's enough cholesterol and choline. In human milk, the lipase is present. In cow milk, lipase is absent. And the solute load in the human milk, solute load is 0.2%, while in case of cow milk, it is 0.7%. In the human milk, the sodium is 6.5, chloride 12, potassium 14, osmolality 290, while in case of cow milk, H contains 7%, sodium 25, chloride 29, potassium 35, and osmolality 350 milliosmol per dl. And the minerals, in human milk, the calcium is 35 and the phosphorus is 15. So calcium phosphorus ratio is more than 2, important for calcium absorption. And the iron is little, but it is bioavailability is good. So there is no iron deficiency anemia in first 6 months of life. While in cow milk, the calcium is 140 too much, phosphorus is 90 too much. So the calcium phosphorus ratio, it is less than 2, and iron is little, 0.01 to 0.38. In human milk, there is a sufficient amount of all vitamins except vitamin K and vitamin D. And the calories, it is 65, and anti-infective agents present in the cow milk, in the human milk, that is bifidus factor, secretory IgA, IgM, IgG, lactoferrin, lysozymes, lactoperoxidase, and oligosaccharides. While cow milk, vitamins are insufficient and the calories 69, and there is a anti-infective agents, they are inadequate in cow milk. In human milk, there is no contamination, but only there is a side effect or disadvantage is hemorrhagic disease of newborn if there is a prolonged breastfeeding. And the cow milk, there is chances of adulteration, contamination, pesticides, antibiotic, and strontium. And it leads to infection. In human milk, there is a breast milk jaundice. It leads to rickets, transmission of viral infection, cytomegalo, HBV, and HIV. In cow milk, there is it leads to tetany, cow milk allergy, late onset metabolic acidosis, iron deficiency anemia, and also acrodermatitis enteropathica due to cow milk ingestion. Due to cow milk, there is a copper deficiency, hypertension, sucrose intolerance. Also, there is a chances of dental caries in the baby, type 1 diabetes, and infantile obesity. So, breast milk important for brain growth, and this cow milk, it leads to there is a body growth. So today's key message for this smart nutrient, there is a put the baby to feed at breast as soon as possible after birth, preferably in delivery room. And this is important for the mother, baby, and for the milk production. On the first day, breast milk is thick and yellowish. There is a colostrum. Feeding these provide nutrition and prevent infection. And the baby feed during day and at night at least 8 to 10 times, and whenever the baby cries with hunger. And more the baby suck at breast, more the milk the breast will produce, and healthier the baby becomes. Breastfeeding should be continued during diarrhea as well as other minor illness, and it helps the baby to get optimal nutrition and recover from the illness faster. Breast milk for a brain growth. It contains amino acid specific for the brain development, rich in sulfur containing amino acid. There is cysteine and methionine ratio is high, and this compensate for a low cysteine methionine conversion, which is essential for CNS development. It is rich in taurine, and which is important neurotransmitter and neuromodulator for the brain and a retina. Thank you.
Thank you so much, sir. Thank you for your wonderful inputs upon the topic that you have shared today with us. We hope that all the viewers who were here with us on this particular week and the first series that have started will definitely help them with their with the knowledge that you have provided to them. So we have received few questions, sir. With all your due permission, I would like to put it across to you.
Okay.
Yeah, the first question is, if baby is completely on breast milk, what are the reasons behind giving vitamin D supplement?
Because I already told in the breast milk, the less amount is this vitamin K and the vitamin D. So vitamin K is should given after the delivery to the all newborn for prevent hemorrhagic disease of newborn and also prevent rickets. There is a vitamin D deficiency, so supplements vitamin D.
Thank you so much, sir, for answering this question. We'll move to the next question. And the question is, animal milk is deficient in neuroproteins. Who will stop animal milk, either government or pediatricians? No other branches of medical science are interested in promoting mother's milk.
I do. Pardon me.
Yeah, so
What
this
is the
question is not clear. The statement states that animal milk is deficient in neuroproteins. Who will stop animal milk, either government or pediatricians? No other branches of medical sciences are interested in promoting mother's milk. So I suppose the viewer wants to know whether the promotion of mother's milk is required, because nowadays medical sciences do not promote mother's milk. They promote animal's milk. So should it be banned from the government's end that no, animal's milk should not be promoted and it should be mother's milk?
If there is a animal's milk is there, if there is a goat milk is used, then there is a chances of there is a megaloblastic anemia in the baby. If there is a camel milk is there, also it leads to the megaloblastic anemia. If they use this cow milk, then there is a chances of tetany and the cow milk allergy and obesity, hypertension, and diabetes and whatnot. So animal should not promote for the first 2 years of baby for a optimal growth of the brain and the baby's growth and development. Promote only breastfed milk, not animal milk.
Thank you so much, sir. Thank you for answering this question. That was the last question for today's session. And I would like to thank all the viewers who had joined our platform for this particular session and for putting across their questions. So any feedback from your end, sir, before we conclude? Any last comment from your end, sir, before we conclude?
My last comment?
Your last comment, sir. Any last comment
Okay.
from your end?
So breast milk, it is optimal nutrition for a optimal growth and the development of the baby. So give only breastfeeding. There's exclusive breastfeeding up to 6 months Also, ideal frequency 8 to 10 times in 24 hours. Also, give night feeding to avoid hypoglycemia. And fourth, continue breastfeeding. Uh, Continue breastfeeding when there's a minor illness for a fast recovery. And also this, if you give breastfeeding, then there's a chances of diarrhea, pneumonia, and it prevent malnutrition in the baby.
Thank you so much, sir. Thank you for answering and for putting up your last comments, to valuable comment from your end for concluding the session for today. Thank you so much for that. We are hoping and we hope to see you soon in with our next interesting session on some other topic. So thank you so much for your valuable time, sir. With this, we are concluding the session here for today.